Hello, everyone. Welcome to the Medic World Study with Dr. Mahi. Today, we will discuss previous year questions from INICET 2021 of orthopedics. So, let's start with our first question that is, which of the following is seen in osteoporosis? We all know osteoporosis is a common metabolic bone disorder which is characterized by a diffuse reduction in the bone density due to decrease in the bone mass. Now, in the question, we are asked about the chemical parameters, that is, calcium levels and levels. So, in osteoporosis, the calcium and ALP levels and also phosphate is normal within normal range. So the answer to this question is option B, that is normal calcium and normal ALP. Now the next question is 15-year-old boy was brought to the ER following a motor vehicle collision complaining of pain over the hip. The X-ray is given below. What is the next step of management? First of all, we have to see the radiograph given here. Here, in the radiograph, we can see there is upward and lateral dislocation of the left femoral head with an obscured lesser trochanter, which is suggestive of posterior dislocation of the left hip. And the next step of management in posterior dislocation of hip is closed reduction and assessment of hip stability. So the answer to this question is option A, that is closed reduction and assessment of hip stability. Now the next question, which of the following findings appear late in compartment syndrome? Acute compartment syndrome. First of all, we have to understand the term compartment syndrome. It is a surgical emergency which is caused by increased pressure within the fascial compartment leading to tissue ischemia. It is characterized by rapid progression of pain and swelling in an extremity, commonly precipitated by traumatic injury. Now, the answer to this question, which is the late finding. So, the first finding we all know is the pain, which is not responsive to analgesics. And the last finding is pulselessness. So, the answer is B. All other findings are also seen in compartment syndrome, but the late or last finding is pulselessness. Now, the next question, which of the following statements are true about open fractures? Let's read the statements. Tibia and phalanges are most commonly involved. It is a true statement. Usually, no coexisting injuries. It is a false statement because open fractures are associated with coexisting injuries. Compartment syndrome does not occur in open fractures. It is also a false statement. Early debridement should be done. It is a true statement. So the answer to this question is option 1 and 4. That is B. Next question is, an old lady slipped and fell at home. She was diagnosed with Cooley's fracture and managed with a POP cast. What is the correct sequence of reduction? We all know in Cooley's fracture, the correct sequence of reduction is propaganda. It is the mnemonic. PRO means pronation, PA is palmar flexion, and UN is ulnar deviation. So let's check the answers. Traction, yeah, it is given. POP. POP is at last we are applying the cast, na? So it is the wrong option. Traction, palmar flexion, ulnar deviation, and POP. This can be the answer. Let's check the other options. Traction, ulnar deviation, then palmar flexion. No, palmar flexion is first, and after that there is ulnar deviation. So it is also the wrong option. Palmar flexion, ulnar deviation, traction, then POP. No, because traction is given at first. So the answer to this question, option B, that is first traction, palmar flexion, ulnar deviation, and POP. Now the next question, match the following fractures and their sites. Jones fracture, Bennett's fracture, March fracture, and Boxer's fracture. Let's start with the most common one. We all know March fracture is in the second metatarsal. So C is 2. No, we got the answer. The only one option has given C2. So the answer to this question is option A. Let's check the other options. Jones fracture A1 is fifth metatarsal. It is the true statement. Bennett's fracture first metacarpal. It is the true statement. March fracture second metatarsal. And Boxer's fracture is fifth metacarpal. So let's move towards the other question. Arrange the following in correct sequence for the Thomas test. So, first of all, what is a Thomas test? It is a test used to detect flexion deformity of hip. It is also a one-liner which came in one of the exam. Flexion deformity of hip. Now, flexion deformity is a common hip deformity often caused by stronger flexure muscles overpowering the extensor muscles. When there is a spasm of the muscles, the stronger flexures pull the hip in flexion. Soft tissue contractures can convert this into a fixed flexion deformity, making locomotion impossible. So, to check this deformity, we have a test known as Thomas test. Now, the steps of this test include, that is, the first step is we have to look for the exaggerated lumbar lordosis. Just identify the first statement. First is look for the exaggerated lumbar lordosis. 3 is the first. Okay, we have ruled out option A. Now, the next step is flexion of the hip. 2. We have ruled out fourth option 2. Now, next, monitor for overcorrection of the normal side. Okay, um, second option is also ruled out. The answer is option C. So let's check the other statements. After monitoring for the overcorrection of the normal side, we see ensure the ischial tuberosity touches the ground, and after that measure the actual flexion deformity. Okay, now let's move towards the other question. Following a femoral shaft fracture, your consultant asks you to provide a tibial traction. Which of the following will you request from the nurse? Thomas splint? No. K-wire? No. Steinman pin? Yeah, it is required for traction. Denham spin? No. Bowler stirrup? Yeah, it is required. And bowler bronze splint is required. So the answer 356 is option B, that is 356. Now the next question. The deformity shown in the image below, noted when the patient tries to extend his fingers. When the patient tries to extend his fingers, these two fingers are not extending. Injury to which nerve can lead to this deformity? So, this region of hand is supplied by the ulnar nerve. So, the injury to ulnar nerve can cause the deformity shown in the image, ulnar claw hand. So, the answer is option A, that is ulnar nerve. Now, the next question, a 60-year-old woman with a history of Cooley's fracture 8 months ago comes to the orthopedics OPD. Her T score is minus 2.5 and she attained minus 2.5 is her T score and she attained menopause at 52 years. She is currently asymptomatic. What treatment will you give to this patient? This is a case of osteoporosis because an elderly postmenopausal woman, 60-year-old, Cooley's fracture, menopause in 52 means postmenopausal female, elderly female, presents with Cooley's fracture. P score is minus 2.5. All of these suggest to the diagnosis of postmenopausal osteoporosis, and the treatment of choice for this condition is bisphosphonate, that is, such as alendronate. So the answer is option B. Now, the next question. Following a road traffic accident, a patient develops type 3A compound tibial fracture. Arrange the following external fixators in decreasing order of their stability. Means most stable is we have to arrange in the order where most stable is placed at first. Elizarov fixator. So, yeah, it is the stable one. Uniplanar with single rod, it is the least stable, so it is placed at last. So 2 is at last. In option C, let's check the other statements. One is Elizarov, then a biplanar frame or ring with cylindrical rod, then uniplanar with double rod, and the last one is uniplanar with single rod. So the answer is option C. Now let's move towards the other question. A 45-year-old patient with a tibial fracture in a cast presented to the emergency department with complaints of intense pain. The cast was removed and on examination, passive extension was painful. This may be the case of compartment syndrome. Now, the dorsalis pedis and the posterior tibial pulses were present, and there was a loss of sensation over the first web space. What is the next step? So, we have diagnosed the case as acute compartment syndrome. So, in case of acute compartment syndrome, after removing the cast, we have to measure the anterior compartment pressure. So, the answer to this question is option C. Now, the next question, match the following with the best mode of management. Osteosarcoma is managed with wide excision. So, 1A, simple bone cyst is managed by intralesional steroids. 2D, giant cell tumor, curettage, osteoid osteoma is managed by radiofrequency ablation. 1A, C. 2D, 3B, and 4C. So the answer is option C. And the last question. In nerve injuries, if outer sheath and nerve fiber are intact while the inner axons are damaged, what is it known as? We all know it is known as axonotmesis, where the inner axons are damaged but the outer sheath and nerve fiber are intact. Thank you so much. Thank you so much, guys, for having patience and listening me out. All the very best. For any queries, you can contact me on the email address displayed on the screen. Thank you so much.